The role of licensed acupuncturists in type 2 diabetes care. So with this video, I want to speak on the education of acupuncturists, our treatment approach, and integration into healthcare teams. Now, if you've ever wondered what it takes to become a licensed acupuncturist, the answer is quite a lot. This path involves rigorous training, a deep understanding of both Eastern and Western medicine, and a strong commitment to patient care. Now let's start with education. Most licensed acupuncturists begin by earning a master's degree in acupuncture or Chinese medicine. And so before you can apply to this program, of course, you have to meet the requirements. Mostly it's just the credits of like getting your bachelor's degree. Now the master's program typically takes 3 to 4 years of intense study. And while it's not required, many choose to continue with a doctoral degree, which adds another year or two, and sometimes 3. And this advanced training focuses on integrative medicine, research, and clinical excellence, all essential for today's healthcare landscape. And that's what I have. I have a doctorate degree in acupuncture and integrative medicine and a master's degree in traditional Chinese medicine. Now let's talk about the clinical hours. Students log in over 3,000 hours in clinical and classroom settings. Of course, it's more than 3,000. That's why I said over. And that's a lot of hands-on experience, working directly with patients under the guidance and skill of supervisors, long before that we ever begin to practice on our own. The training is comprehensive. It includes the foundations of traditional Chinese medicine or East Asian medicine, alongside with Western biomedical sciences like anatomy, physiology, pathology, and pharmacology. Now, this blended approach ensures that licensed acupuncturists can communicate effectively with other healthcare professionals and provide well-rounded care to their patients. Now, after graduation, the journey isn't over just yet. Practitioners must pass national board exams through the National Certification Commission for Acupuncture in Order of Medicine, or the NCCAOM, and they also need to meet any state-specific license requirements. I know in California we have the KO boards that you also pass. And finally, with all the education, clinical training, and certification in place, they earn the title of Licensed Acupuncturist, or L.AC, of qualified to deliver safe, effective, and holistic care. Now, how acupuncturists treat pain and internal conditions. When most people think of acupuncture, they think of needles. But the truth is, licensed acupuncturists use a variety of techniques to treat pain and support internal health, often with powerful, long-lasting results. Now, acupuncture. At the heart of treatment is acupuncture itself. Tiny, hair-thin needles are placed at specific points on the body to modulate the nervous system and reduce inflammation and restore balance. It's not just about pain relief. It's also about the body healing from the inside out. And you see in this picture, practitioners needling someone's leg. Now, herbal medicine. In many cases, herbal medicine is used alongside acupuncture. These custom formulas are designed to support organ function, boost energy, and improve metabolic health. Think of it as nutritional therapy tailored to your body's unique needs. And then there's manual therapies. Acupuncturists are also trained in hands-on techniques like Tui Na, which is a Chinese medical massage, cupping, and moxibustion, which is the warming of specific points using herbs. These therapies help improve circulation, ease muscle tension, and enhance the effects of the acupuncture. And then also lifestyle counseling. And finally, treatment often includes guidance on diet and lifestyle, all from a TCM perspective. And then recommendations are personalized and might include some specific foods, exercises, are stress relieving practices that support your healing journey. Now, together, these therapies form a holistic system of care that addresses not just symptoms, but the root causes, helping you feel better, move better, and live better. Now, in California, licensed acupuncturists are recognized as primary healthcare providers authorized to diagnose, treat, and manage a wide range of health conditions. They operate with independent practice authority, meaning patients can seek acupuncture care directly without needing a referral from a physician. Now, acupuncturists in California have diagnostic authority, allowing them to order and interpret laboratory tests and imaging studies to inform their treatment plans. Now, as a primary care provider, they offer comprehensive care addressing both acute and chronic conditions through a holistic approach that integrates traditional Asian medicine practices. This framework enables acupuncturists to serve as an integral member of California's healthcare system, providing accessible and effective treatment options for diverse patient needs. And I am a licensed acupuncturist in the state of California, so that's why I'm bringing attention to the status of acupuncturists in California. Now, acupuncture and TCM for type 2 diabetes management. Managing type 2 diabetes goes beyond just diet and medication. And TCM, we look at the whole picture, how the body functions, where it's out of balance, and how to restore harmony. Let's break down how acupuncture and TCM can help support people with type 2 diabetes. Now, first, blood sugar regulation. One of the core benefits of acupuncture is that it helps regulate blood sugar levels. Research shows it can improve insulin sensitivity, helping the body respond better to its own insulin, naturally supporting glucose control. And then also herbal support. Herbal medicine plays a big role too. TCM formulas are designed to regulate blood sugar, improve insulin sensitivity, reduce inflammation, and support organ function, especially the spleen, liver, pancreas, which are key to metabolic balance in TCM. And then also enhance circulation. So techniques like moxibustion, a warming therapy, and cupping are often used to improve circulation, which is especially important for people with diabetes who may have issues with blood flow to their hands and feet. And then also stress reduction. Chronic stress is a major contributor to high blood sugar, also high blood pressure too. But acupuncture is well known for its calming effects on the nervous system. By reducing stress, it helps address one of the root drivers of type 2 diabetes, something that's often overlooked. And integrative approach, combining Eastern and Western medicine. When it comes to health, it's not about choosing between Eastern or Western medicine. It is about bringing the best of both worlds together. That's the heart of an integrative approach, where traditional Chinese medicine works hand in hand with modern biomedicine to support whole person healing. And then also the medical collaboration. Licensed acupuncturists often collaborate with primary care doctors, endocrinologists, and other specialists. This team-based approach ensures that care is safe, comprehensive, and aligned across all providers. And then data-driven care. We don't ignore the labs. In fact, we use them. Acupuncturists trained in integrative care often review lab results like blood sugar, cholesterol, and inflammation markers to personalize treatments. These results can help inform a TCM diagnosis, creating a deeper understanding of what's happening in the body. And then medication support. While acupuncturists, we don't prescribe pharmaceutical medications, we can help support patients who are on medications by managing side effects, enhancing effectiveness, and communicating with prescribing doctors when needed. It's all part of a supervised, safe care plan. And then treating the root, not just the symptom. One of the TCM strength is addressing the root causes of imbalance, such as stress, digestive issues, and chronic inflammation. These are often underlying factors in conditions like type 2 diabetes, high blood pressure, or fatigue, and treating them can lead to long-lasting improvements. By combining the wisdom of Eastern medicine with the tools of Western science, integrative care empowers patients to take charge of their health holistically, safe, and effectively. Now, why acupuncturists should be part of a diabetes care team. When managing type 2 diabetes, most people think of their primary care, the MDs, nutritionists, and maybe even physical therapists. But there's one key player often left out of the conversation: licensed acupuncturists, doctors of acupuncture. Here's why they should absolutely be part of the diabetes care team. Okay, number one, a holistic approach. Acupuncture and TCM take a whole body view of health. We're not just focused on blood sugar numbers. We look at how the body is functioning overall. This complements conventional care, filling in the gaps by addressing issues like stress, digestion, sleep, and energy, all of which impart diabetes management. And then second, reduced medications. With consistent acupuncture and herbal support, some patients may find that they can reduce their reliance on certain medications. Of course, always in partnership with your prescribing physician. The goal is to support the body's natural balance so drugs become less necessary over time, not more. And then also 3, metabolic support. Acupuncture has been shown to help with blood sugar regulation, weight management, and insulin sensitivity. Combined with nutrition and exercise, it's a powerful tool for supporting metabolic health in a sustainable way. And then symptom management. We also help manage the symptoms of diabetes that can really affect quality of life. Things like fatigue, neuropathy, poor circulation, and even stress-related cravings. Through acupuncture, herbs, and lifestyle guidance, these symptoms often improve, giving patients more energy and less pain. Including an acupuncturist on the diabetes care team means addressing the roots, not just the numbers. It's about giving patients more tools, more support, and more hope for long-term wellness. Now, call to action. You deserve a bigger support team. If you're living with type 2 diabetes, you know it's not just about taking medication. It's about your whole life, your energy, your stress levels, your sleep, your food, your mindset, and that means you deserve a care team that sees the whole you. Let's recognize acupuncture as part of your team. Licensed acupuncturists are trained professionals who can help manage blood sugar, reduce stress, ease fatigue, improve circulation, and support your body's natural balance. They should be seen as an essential part of diabetes care, not an add-on. Let's advocate for better access. We know it's not always affordable, but that needs to change. So together we can speak up for better insurance coverage and referrals so more people can get the care they need, including acupuncture and holistic therapies. Let's choose care that looks at the whole person, the whole picture. When you combine Western medicine with Eastern approaches like acupuncture and herbal therapy, you get a more complete, personalized care plan, one that supports you and not just your numbers. Now let's work toward better outcomes together. You deserve more than just managing symptoms. You deserve to feel good in your body again. Acupuncture and traditional Chinese medicine are evidence-based tools that can help you improve energy, reduce complications, and feel more in control. You're not in this alone, and you don't have to settle for one-size-fits-all care. Ask about integrative options. Talk to your primary care MD doctor. Let's build a care team that works with you and for you.